good morning! How are you this morning? Now our top song for this week, we have our very own Asian songstress, Kimberly, from your favorite radio station for life.
Led you to the tree with the split and its trunk on the way into your family's yard. In that tree you saw I brought the dog back to life. I watched you from the branches while you stared from the ground with a look I couldn't understand. So I said, leave me alone. If you're on
Good morning, Doc.
Good morning! So how was your weekend?
It was fine.
That's good. What's my appointment for today?
You actually have 5 scheduled patients, 3 exo and 2 OP.
Is Doc B around?
Yes, he's in the first
Oh,
patient.
okay. So I'll just change it to my scripts. Thank you. Excuse me. Sorry, I'm late.
Good morning, Doc G.
Morning. So, what seems to be the problem with Miss Mary?
Miss Mary has swollen cheeks.
Mm-hmm.
Her muscles are tender, but I cannot seem to check her oral cavity due to a minimal opening of her jaw.
Miss Mary, what have you been doing lately that might have caused this pain?
I recently joined an eating contest, but I felt pain in my cheeks, so it resulted to the swelling.
Doc B, what's your diagnosis?
Miss Riva seems to have a myofascial pain dysfunction of the muscles of the TMJ. It is usually caused by the overuse of masticatory muscles, particularly the lateral pterygoid.
May I see your teeth, Miss Mary? And I also noticed that her teeth is abraded due to bruxism or night grinding, and that may be also one of the causes of the pain in her TMJ. I can recommend 2 treatments for you, Miss Mary. The first one is medication, so that to improve your sleep and relieve pain as well. And what else, Doc B?
A mouth guard can be used to protect your teeth from abrasion, but the swelling should be treated first. So take this pain reliever while waiting for the swelling to subside.
That's right.
Excuse me, Doc G.
Yes?
One of our VIP patients is here. I think it's an urgent.
I can take it from here. You can go.
Okay, thank you.
Thank you.
The manager said that she dislocated her jaw while singing, and I think what happened is she tried to reach a certain note, and then she wasn't able to close her mouth again. Here's her X-ray. Oh, here's the patient.
Thank you. Good morning, Miss Kimberly. It's nice to see you again. And I was just listening to you earlier this morning, and I've heard from your manager that you somehow dislocated your jaw. Dislocation of the jaw happens when a person opens his or her mouth too wide and he or she unable to close it.
Huh?
Dislocation of the jaw happens when the condyle of the jaw glides too far forward and moves too far in front of the articular eminence. So when you try to close it, the condyle can't move backward. Muscles are trying to pull upward and backward, and the articular eminence does not allow it to move back. Mostly, the reason for this condition is what we call subluxation, or the excessive mobility of the TMJ. So I've just reviewed your X-ray, and it doesn't seem that you have any fractures in your mandible. So the safest treatment that we can do is just reposition your TMJ back to its normal position. Is that all right? Okay. So let's start. So what I will be doing is just putting my thumb at your retromolar area while palpating your TMJ. And I will counteract your temporalis muscle by bringing down your mandible. And when I feel the clicking, I will now retract your mandible and move it upward. Then I will do the same at the other side.
Doc, I'm just curious, how does our jaw work?
The muscle act on the temporomandibular joint to achieve opening and closure of the jaw protrusion and retrusion, and alternate lateral movements. Since these movements really occur in isolation, most involve complex combination of muscles activity. The muscles also act on the temporomandibular joint to provide stability, or during mastication, the forces applied to the joint not only are great, but also are constantly changing. And even this is considered with the destabilizing effects of translatory movement. The functional role of muscles become more obvious. An example is biting, which demands that the disc be stabilized in a slightly forward position. This stabilization is achieved by the upper fibers of the lateral pterygoid muscle.
Ah, okay, Doc. Thanks for the info.
Okay, so I will set an appointment for the construction of mouth guard. But first, take the pain relievers first. I'll prescribe this one.
And now we're done.
Oh, I can close my mouth again. Thank you very much, Doc. I'll send you tickets for my world tour.
Thank you.
Oh, come okay.
Of course I will. Thank you.
Thank you, Doc.
Okay guys, another successful day in the clinic. It's time to go home.
Go ahead, guys. I have something to attend to.
Okay,
Bye.
take care. What's up with him?
I don't know. He's been like that since earlier.
So, are you not going home yet?
No, I still have to finish up papers.
Okay, so we'll just take care when you go home. Bye.
Bye.
Alexa, play.
White lips, pale face, breathing in snowflakes, burnt lungs, sour taste. Lights gone, days
Alexa,
end.
stop. Hello?
Hello, Doc. There's an emergency here in the clinic. You need to come.
Is Doc be there?
No, I can seem to reach him. You need to come right away. It's
Okay,
very
okay,
urgent.
I'll be there right away.
Doc! Thank God you're here.
So what did the medic told you?
So her mandibular condyle was fractured,
Oh.
most probably caused by external blow to the mandibles.
So let's see the patient now. How long has it been since she was unconscious?
About 30 minutes ago?
Okay, so we still have time. Where's Doc B anyway?
I don't know.
I'm here.
There he is.
What's your stat?
So the medic told us that she had a mandibular condyle fracture. Since her OMS, what should we do?
We need to take an X-ray first, but most likely, we need to do an intermaxillary fixation in order to stabilize the maxilla and the mandible. Monitor her vital signs and prepare for X-ray and surgery.
Okay.
Doc B, why are you still?
Prepare for X-ray and remove all of her belongings. The muscles act on the temporomandibular joints to achieve opening and closure of the jaw.
Dio.
Ulit.
The medic told us that she had a mandibular condyle fracture. What? Okay guys, another successful day in the clinic.
I'll prescribe this one.
So when you try to close it, the condyle can't move backward. Muscles are trying to move backward. Muscles